Hi everyone, thank you for joining. We're going to get started as our watch shows. It is noon and we want to be respectful of everyone's time. So thanks again for joining us on this webinar that's titled Communication Skills for Successful Healthcare Team Relationships. And it's been being presented by the Western Region Public Health Training Center, California State Office of Rural Health, and the Southwest Telehealth Resource Center. Next slide, please. We'd like to give a welcome to all the regions are joining us, especially the region for Western Region Public Health Training Center, the Southwest Telehealth Resource Center region, our fellow HRSA grantees, and all other participants joining us from the U.S. and abroad. Next, please. The webinar is approved for continuing education credits. We are approved for 1 CNE contact hours, 1 CECH for CHES, and 1 CPU for RDs. Next slide. Here is a list of the learning objectives, which our presenter will review later on as well. Next slide. The planners and presenters have no relevant financial relationships to disclose. Next slide. And the nursing evaluation forms will be available after the webinar, excuse me, and you will be able to fill out an evaluation form to get a completion certificate. Next, please. Just some housekeeping rules. Please mute your phones and computer microphones. We will have time at the end for Q&A. So in the meanwhile, if you have any questions, please use the chat feature to submit any questions you have. We will have a web evaluation post-webinar survey that will be, the link will be provided at the end of the webinar as well. This webinar will be recorded and recordings will be posted on the Southwest Telehealth Resource Center website and the Western Region Public Health Training Center website. Next slide. All right, so I would like to introduce our presenter, Kathy Frey. And Kathy Frey has over 25 years of experience working in a variety of different healthcare organizations. Currently, Ms. Frey serves as the Chief Executive Officer for the Central Valley Health Network, a network of community health centers located throughout 20 counties in California's Central Valley. Prior to joining the Central Valley Health Network, Ms. Frey served as the Executive Director for the Alliance for Rural and Community Health and as Director of Health Policy and Resource Development for the Redwood Community Health Coalition. She has held administrative positions in large hospitals, private practices, and coordinated the continuing education program for physicians at the California Medical Association. And Ms. Frey is a member of the Board of Directors for the California Primary Care Association, where she served as a chair of the board from 2009 to 2010. Nationally, Ms. Frey continues to serve on several committees of the National Association for Community Health Centers, including the Rural Health, Legislative, and Health Policy Committees. So now I'm going to turn it over to our great presenter, Ms. Frey.
Thank you so much. I appreciate that. Hopefully you can hear me okay? Yeah. Wonderful. So thank you for this opportunity. Thank you for all who've taken a few minutes of your time today to join us on this webinar where we're going to talk a little bit about communication skills, particularly in relationship to healthcare teams and healthcare team relationships. Just to go over a little bit, what I hope you will get out of this webinar is to review and understand how communication and group dynamic issues can impact the working relationship within a healthcare team. Lots of emphasis on healthcare teams and how we should all work together. I'm hoping that through this webinar, you'll come away with some tools and resources that will assist you as you're thinking, as you're either dealing with some issues in your healthcare team or just in communication skill development in general. Learning objectives, I hope by the end of the webinar that you recognize and understand the importance of communication and relationship development, especially in the development of and working of a healthcare team. A second objective would be to identify communication strategies for participants, meaning you, to use that would help you foster better communication within your own lives in general, or within your healthcare teams, or within the work that you do every day. Another objective, understand the theory of group dynamics and how group dynamics apply to healthcare teams. And then finally, to recognize the characteristics of an effective and an ineffective team, and then look at and identify strategies that would move that team from being ineffective to effective. So with that, let's dive into this. Communication, what is it really? I think we can all agree that communication is really the foundation of a good functioning healthcare team, and in particular, our healthcare teams. If your healthcare team isn't functioning, in reality, it's the patient who's going to lose, because as we're moving toward a system where we want a team to take on the care of a patient, that team has to communicate, has to function well, and communication is really the key to that. I got started in this by teaching a class at Fresno Pacific University, where I'm an adjunct professor, on healthcare leadership, and I'm teaching to graduate students who are about to become nurse practitioners. And one of the components of the class that I teach is really on communication and relationships. And quite frankly, it's been one of the more successful and classes or lectures that I provide to the students, and they love it. So it was very nice to be asked to present this to you all today. But when we get back to communication, what is it really? And there's a definition of communication. This is from Webster's dictionary, and I find it very interesting that the very first definition has to do with the act of transmitting, as in communication of disease. But this is right out of Webster's dictionary. I thought that was quite interesting. But when you get down to it, Webster's defines communication as information that's communicated, it's transmitted, it's conveyed, it's a verbal or it's a written message. Communication, it's a process by which information is exchanged between individuals through signs, symbols, behavior. That's how they define it. I found this little image, and it really is very simplistic, but one of us is a sender and one of us is a receiver. One of us is giving a message and somebody's receiving that information and providing feedback to the sender. I think irrespective of healthcare teams or healthcare in general, each of us every day is both a sender and a receiver of information. And I think that's important. Communication is very important because, quite frankly, this one made me laugh a little bit. As the cartoon says, if we don't have good communication, there are things that can go wrong, and gosh knows we don't need people being dropped in operatories because we couldn't figure out that we had to lift on 3, 1, 2, 3. So, but getting into kind of communication and relationships, there's a saying that I pick up from John C. Maxwell. This is from the book, The 21 Characteristics of a Great Leader. And this phrase, I think, basically sums it up. Communication, without it, you travel alone. And I think we can all agree that if you're not communicating with somebody, you're very alone. But communication is a two-way street, as our little stick figure friends say. One of us is a receiver and one of us is a sender. One of us is a communicator and one of us is receiving that information. But communication isn't effective unless somebody is an effective communicator. And being an effective communicator, I think we all think we are. I know sometimes I feel that I'm an effective communicator and sometimes I'm not, getting across how important it is I want somebody to do something. And over the years, these kind of little tips have helped folks understand a little bit more how to be an effective communicator and what is being an effective communicator. Perhaps that's the better way of saying this. I think first and foremost is being an effective communicator, you need to simplify your message. And sometimes it's not what you say, it's how you say it. Keeping your message simple and remembering your tone of voice. We don't often think about a tone of voice when we're asking somebody to do something or telling somebody to do something. And part of that if you think about it for a minute, if someone says, please hand me that, or please, could you hand me that? Those are two different tones of voice that someone could interpret very different ways. The please hand me that is a tone of get it done, I want it, I'm in a hurry, I'm upset, I need you to do this. Whereas please hand me that is more, thank you so much, I'm respecting the fact that I'm asking you to do something. We sometimes in our busy lives don't think about our tone of voice, but you would be surprised at often how it's not what you're saying to somebody, but how you're saying that can make all the difference in whether that individual is actually receiving the information and processing it and responding. This other one I think we can all agree on, believe in what you say and live in what you say. Walk the walk and talk the talk. I think we all know what that means, but I think that's another important component to being an effective communicator, that you're communicating and you're asking someone to do what you would do. You're walking the walk, you're talking the talk. This next one I find, I actually like this next one. Seek a response. An information dump is not communicating. If you're trying to give somebody instruction, or you're trying to, give instruction, get a point across, and you just go on and on and on and on and on and on and on without any opportunity for feedback, that's kind of an information dump. And oftentimes you can tell when you're dumping, quote, dumping information, because that person kind of tends to tune out. They may be nodding their head, but you have no idea. They may have tuned you out a long time ago. Seeking a response from somebody is very important. And I know this is really hard to do in a healthcare setting sometimes, but I find that if we take a step back and remember, as we're in a very busy healthcare system, to take a step back and understand that we're actually dealing with people, because people are who make up who we are. I think seeking a response, asking people to respond, not just dumping information to them, is doable. And what's funny is we're doing this webinar on communication. I'm talking about information dump, and yet there's no opportunity for you all to ask questions. And so in some ways, I hope you don't see this webinar as just an information dump, which I hope you're going to ask questions or, excuse me, use the chat box. But I do find it interesting and kind of a little funny that I'm doing an information dump to you, and that's not exactly how I hope this would go. Finally, I think it's important that you see the person for who they are. What are you trying to communicate, and what are they hearing you say? And we'll get into a little bit of that in just a minute about how people hear things. We all assume that when we give instruction or when we're talking to somebody that they're hearing us, that they're listening, they're actually processing the information that we're asking them to process, and they're going to respond. And we might be surprised sometimes when they don't. And if you're not asking that person, do you understand? Because you want to make sure that, did you get everything that I said? Do you have any questions? If you're going to give somebody a lot of information, taking time to step back and go, do you have any questions? Anything I can clarify? That's seeking a response from that individual, which you would be surprised can go very far in them really understanding and responding to what you have to say. And I think as we're looking at healthcare teams and the different disciplines that are now working together, it's not all clinical. I think our healthcare teams are very multidisciplinary, and sometimes we may assume that someone is understanding what we're saying when in reality perhaps they don't, and maybe they're a little nervous or a little afraid, or quite frankly a little chagrined to be asking you, I don't quite understand what you're asking me. So the opportunity to seek a response in a very professional manner of, do you have any questions, and please don't hesitate to ask if I'm not making sense. Just those little phrases alone, I think, can increase comfort level of somebody saying, yeah, I don't really understand what you're saying. on that same line, how people hear what you say, we hear things differently. And part of being a communicator is as we go back to that little stick figure of the sender and the person who's sending the information and the person who's getting the information and feeding it back to you. There are two parts, I think, of being an effective communicator. One is understanding how we all, because remember, we're both the sender as well as the receiver, how we individually process information and how other people process the information that we are giving them. And the second component is how we understand ourselves in processing information. So I want to talk a little bit about how we process information and the we being collectively. There's a concept, a theory out there, neuro-linguistic programming, and it was developed by Richard Bandler and John Grinder many years back. But it's really an approach to communication, personal development, and psychotherapy. And for those of you who are, perhaps in the behavioral health field, you may know this already. I found this fascinating when I learned about this taking a facilitation class. This was a concept that we learned about in terms of facilitating large groups. But as I've taken this concept and again used it in my everyday life of how people hear what I'm saying or how they're responding to in my everyday life, not just in my work life, it makes a lot of sense. And so the theory here is that our five senses are very much a part of our everyday life, not just in the food that we eat and how we smell, but we hear sounds and we taste and we smell. And those senses connect us basically to the world, but they also are part of how we store and process information. And each of us has a preferred way of how we process that information, how we store information. And that those systems, how we process it, falls into basically three categories. One being kind of visual. We're visual learners. We need to see things. One is we're auditory. We hear. That's our preference, our preferred system. And then the third being kinesthetic, where we're kind of more active and touch is more important to us in terms of learning. And you might be asking, well, what does this have to do with communication and healthcare teams? Well, actually there's a lot. When I started putting all these pieces together, I can see how someone who's auditory, as it says here on the slide, someone who their preferred system for taking in information and processing information is auditory. They do things in patterns. They're very good at repeating things back to you and saying, as it says here, we work together in harmony. They listen and they rely on their hearing and speaking to process information. And oftentimes, if they don't hear it, it doesn't really exist. So if you just have a piece of paper that has something written on it and says, take care of this, a person who's an auditory processor, if you will, may not quite do what you want them to do because they're not a visual person. You've given them a picture or a drawing or a map to read or something, and they're like going, well, this doesn't make any sense. I think the map is a perfect example. Someone who is an auditory person probably relies more on their GPS system in their car to tell them turn left in 5 minutes or turn left in 30 miles in terms of directions. A person who's a visual thinker actually is someone who needs to see something, and they can't. It's more important that they see it as opposed to hearing it. I have to laugh when it says here that a visual person is someone who uses descriptive language and performs a lot of hand gestures. As you can tell, I use a lot of hand gestures. Obviously, I'm a visual processor. I see pictures in my head. I am very good at reading maps. As a matter of fact, I much prefer to read a map than to have the person on my car tell me to turn left in 20 miles. I can also process information by hearing as well. But I know I can see myself as a visual learner, and you might know people in your lives, not just at work, but within your, you know, your family members, your coworkers. If you pay attention and think about it, you can probably start to tell how people process information by even these quick little phrases that they use, or the fact that they use a lot of hand gestures might help you understand how they're processing it, how they're processing information, and then how you can better communicate with them. I think the last kinesthetic folks, they're slower and they process more information. A kinesthetic kind of processor, as it says here, they're going to take a little bit more time to process the information. They like to move and do things. These are the folks that are the doers. They like to actually not sit around and think about things. They want to get it done. So if you're giving them information and they're responding to it, they're actually more apt to ask questions, take their time, really process it, think it through before they actually act upon it. If you take a minute to think about kind of how this relates to even a healthcare team, think about a situation where, say, a provider is giving instruction to a community health worker or a promotor or a health coach. And that person may not be understanding, or may have that blank look on their face of, what are you talking about? It may be that they're not a auditory processor of information. They like to see something written down. They need to see the steps. You know, I want you to do this first, and then this, and then this, and then this. I might, you know, as we think about that person, if they're nodding their head saying, oh yeah, I understand what you're talking about, maybe they don't. And somebody's not going to say, well, I really don't understand because I'm an auditory learner or I'm a visual learner. They're not going to say that to you either. I think these are just little tools for us to help us understand how we work with our coworkers better. You know, when I think about this concept of auditory, visual, and kinesthetic, you know, I hearken back to, you know, in medicine, doctors, nurses, clinicians, you're trained to be auditory learners. Somebody's yelling out an order and you're trained to react and act on that order that's being given. Yes, it's written down, but in the heat of things, there's often auditory request that you have to process. In a multidisciplinary healthcare team, there are other folks on that team who haven't been trained that way. I'm thinking, as I said, health coaches, community health workers, promotoras, intake workers, outreach workers, even some behavioral health folks. They may have a different way of understanding and information that you're trying to process. And if they're not understanding what is being told to them, or they're not processing it in the way you want them to, that can have implications for how the team communicates with each other. So that's why I think it's important to kind of put this theory out there for you to think about how people react when you're asking them to do something. If you write it down, do they go, oh yeah, I got it, no problems? Or if you write it down and they kind of look at you quizzically, you know, maybe they're an auditory person and you need to talk to them about it as opposed to just writing it down. So just a tool and a tip to kind of get you thinking about how you talk to and relate to people. The other piece is that this also goes very far in dealing with patients. Think about, as providers, trying to impart information to a patient. Remember, all of us are either processing information by hearing it, seeing it, or kind of slowly processing it. But when you think about engaging a patient in their care, you know, sometimes just telling them what to do and they're nodding their head, maybe they're not really understanding, or they're not processing and getting the information that you want them to get. So that's just not only for our healthcare teams and communication, but it also can work amazingly when it comes to thinking about how your patients hear and understand and process information. The other part about communication, and the other piece of it is, so we're understanding how people manage and understand processing information. How do we understand ourselves? Because understanding ourselves and how is another important part of how we are an effective communicator. This bit, I came across this concept of emotional intelligence after reading through a book by Carson Dye on effective leadership. And the concept here is that understanding and working with other people's emotions, because communication is also about managing emotions, understanding how you react can help you be a better communicator. It helps you manage your own emotional responses. And I'm not going to read through all of this, but you can see here that, that using emotional intelligence means that you're recognizing strengths and weaknesses. You see, these links between feelings and behavior. You communicate openly. You can handle conflict, difficult people, tense situations. There's this idea that understanding this emotional intelligence is sometimes referred to as emotional intelligence quotient, which I just have to love. Your EQ. And that EQ stood for something else, but the best way, and that understanding, so this emotional intelligence, quotient, how you understand yourself, how you understand how you are doing and how you process and how you are dealing with others, how you deal with your own emotions by dealing with others, can actually help you as a communicator. And to do that, I think for, again, those of you who may be in the behavioral health or in other, may have seen this, understanding our own strengths and weaknesses, the way to do that is this concept kind of through this the Johari window, which was developed by Joseph Luff and Henry Ingham, surprisingly, for Westinghouse and in their leadership program. But there are two ideas behind this tool, is that you can build trust with others by disclosing information about yourself, and that with the help of feedback from others, you can learn about yourself and come to terms with personal issues, which go back to your ability to understand your emotional intelligence and your emotional quotient, which makes you a better communicator. And if you look at this window, if you kind of look at the four big blocks on the X kind of line, the open self, what's known to you, yourself. The blind self, what's unknown to you. Open is what's everybody knows about you, and blind is unknown to you but known to others. If you go down on the Y, it's what's known to others and unknown to others. So if you look at each of these four boxes, you can see that they kind of, what's known to you and known to others, what you know about yourself but not to others, what's unnoticed by you but others know about you, and finally, what neither you nor others know about you. And this is really what it's all about. What's known to you and known to others, that's what you talk about at dinner parties, stuff about you and who you are and what you think about. Unknown to you, unknown to others, but known to you, on the weekends, you're an Elvis impersonator. No one knows that, but you do. But what's unknown to you, and known to others, is kind of what's being discussed at dinner parties that you're not invited to, or what people are talking about you behind your back. And then finally, what's unknown to you and unknown to others is basically all the stuff that life hasn't thrown at you yet. I use this a lot in the class that I teach, and it kind of gets a chuckle from folks, but I think it's really spot on in that understand, and part of it is how much you want to give of yourself. Do you really want everyone to know that you're an Elvis impersonator on the weekends, or is that some information that you'd like to keep to yourself? Do you have a way that or a mannerism or something that people just think about you and that you don't know about yourself? and you're not able to, there's no way for you to know unless you ask. It's like, hey, how come I'm not invited to that dinner party? I really wanted to go. It's like, well, because you don't have the right clothes. Well, and that's just silliness. But I think I think it's important for us in the realm of communication to see how this kind of understanding ourselves, keeping this as a little bit of a tool, can help us in our communication. I wish we could stop and ask for questions, but I know we need to be moving. So hopefully if you do have thoughts or questions, you can add them in the chat box and we can get to them after the fact. I'm going to switch gears for just a second and talk about communication and relationships. Using this, another tool, if you will. There's a lot that I'm throwing at you in basically a 45-minute webinar that I usually spend 2 hours teaching, but at least to get the concepts out there, I think it helps. The next part I want to talk about is this idea of the 6-circle model. And this is actually a model that was developed by, as it says here, Margaret Wheatley, and has been kind of modified by Tim Dalmu and Richard Knowles. And this is another kind of theory and concept that I learned about in this facilitation class that I took probably 10 years ago. The model was, and I should back up and say that since learning about this model, I apply this just about every day in everything that I do. And I think once you kind of get the essence of what the concept of the model is, you will see how this applies in not just how you deal with healthcare teams, but also how you deal with just processing information and communicating with people in your life every day. The model was originally developed to really demonstrate aspects of organizational change and how organizations go through and process and undertake change and change management. But when I started really thinking about this, it also applies to communication and can be applied to how a team functions within, how a team can function and how each of these 6 components really work in terms of a team setting. So I'm going to move on. So there are 3 aspects. So if you look at this model, there are 6 areas. And if you look at the arrows, which I'm putting up the screen and you can't see, but there's above the green line. So each of those arrows, if you can see, are kind of green. So there's 3 processes or 3 kind of key points that we have above in this 6-circle model, being structure, pattern, and process. Structure, process. So structure is the way in which an organization describes and does its business, how you're structured. Process is how you actually do the work, and pattern how are the strategies or the things that you do to accomplish your mission. So think about that for a second in terms of a team, how you're structured, how you go about doing your business, and kind of the strategies or the components or the procedures that you, as your team is working together, that you have to accomplish what you're trying to accomplish. Below the green line are kind of these other 3 important areas: information, relationships, and identity. And you're thinking, well, how does that relate to what we're doing in a team? Information really reflects the nature of how information is shared. How is it utilized in decision making? How transparent? How critical? How is the information shared? Right? People have to have information. Relationship has to do with how the team or the organization values its people. The level of connectivity of the people within the team, the value placed upon collaboration, the value and connectivity, how you're getting along and liking each other, those relationships, and think about that in your healthcare team. And then identity refers to the level of the shared purpose, passion, and beliefs of the team and the people as a whole. How are the members of your team bought into the work that you're doing and the importance of it? And if you look at it here, it says, you know, all these three below the green line, we call them, are interconnected. I like this little bit. Information is like the vital nutrients of a system, right? You have to have information in order to survive. Relationships are the conduit that infuse that nutrition throughout the system. And identity is the concept or the mind that organizes the system into its unique entity. Okay, so that's great. Sounds great. How does this relate to what we do in healthcare, and how does it relate to relationships and teams? I think what happens in any situation is we always, when we see an issue or a challenge, we always jump to how to fix it, right? We jump to the pattern, the structure, the process. What is it that has to be done? How are we going to fix it? Let's do it. Let's fix it, right? That's most of us. That's how we like to do it. Get it done, fix it, check the box, good to go. And I think we can think about that even in a healthcare team with a patient. It's like, all right, this patient has this issue. They have their hemoglobin A1C is 9 point something, and we need them to lose weight and exercise. And those are all the things we need to get them to do. Process, structure, fix it. And you on this team, you're going to help them do this. You do this. You do this. You do this. And sometimes that can work, but oftentimes I think what you'll find is that if you take a step back, and especially in a multidisciplinary team, begin to help people understand why that person, what is it, the information that you have that to impart to the team that is going to say, this is why this person needs to do this, or this is why I want you to work with that person to help them lose their weight, or how do we better, what information do you need, team, to help us helping this patient achieve their optimum health outcome? What is the information that you need? You're not just telling them, you're asking them, what else do you need? What other information? How does the team work together? And in a couple minutes, we're going to talk about group dynamics and how group dynamics really do play out in healthcare teams. But how does that team work together with that information? And quite frankly, how, in terms of identity, how does each member of that team feel that they're part of the team? Do they identify with being part of the team? Or do they, are they included? Do they feel that their input is important? Is the team listening to their input? So, as I start to think about this, when I started really looking at this model, I try and practice this every day in what I do. When we have a project, yes, there's a great project that we want to put together, and here's a grant that I'm putting together, and I'm going to give you all the work plans and the objectives and all that stuff. But the reality is my team, meaning our staff, needs to understand why we're doing this project, and how's this project going to work with all of us together, and are each of us who are on the staff feel connected to that project and to that to make it successful. Because I will tell you, if you don't spend time on that part of really making sure people have the information that they want, that they understand they're part of the team and they identify with being part of the team, the top part can fall apart. The process, the fix, the structure, all of that can fall apart relatively quickly if people aren't bought into it. And I think if you start to think about in your own lives, and you can apply this to everyday stuff, it's not just in healthcare, but think about, everyday stuff that you do. If you're just throwing out information, if you're just doing an information dump, you're just telling people what to do, but you're not really engaging them and asking them, oftentimes down the road you will find that you're not going to be as successful as you hope you would. So I think I've taken this concept and I try and practice it every day, and I hope that you will take it and try, think about it and see how you would apply it as well to your team. So we're going to shift gears for a couple minutes. I know I want to leave enough time for questions, but I want to talk a little bit about group dynamics, because this happens in group dynamics. This is across the board. It doesn't matter what kind of team you're on. This is group dynamics in any setting or situation. There are literally 1, 2, 3, 4, 5 stages to a team development and group development. The first one is forming. You know, you're just getting together, everyone's polite, you don't know each other, you're learning about who you are and what you do. There's a storming phase where now all of a sudden, you know, you've gone beyond the niceties and you're kind of pushing. People are pushing. No, I don't want to do that. No, this doesn't make sense. You're not hearing me. Those are storming areas. A team then can move to norming, which means you start to resolve your differences, appreciate the strengths of your colleagues. Performing is you're out there, you're doing what needs to be done. There's no friction. You're just jumping along, moving it. And then in this final one, adjourning, which you may not think applies to us in healthcare, but I will tell you in a second how it could. If it's a short-term team, for a fixed period of time, and you've had a task, you've taken care of the task, you've achieved your objective, you get to celebrate. Here's another kind of depiction of the same concepts of forming, storming, norming, performing, and adjourning. And I kind of like this one where, you know, our little friends here in the forming, they're, you know, everyone's so polite and we're shaking hands. And when you're storming, you're kind of communicating your feelings, but you're resisting control and you're like duking it out, so to speak. Norming, everyone feels part of the team. You feel that you can do the work. You're excited about what's happening. Performing, you're doing it. See, they're running away. They're on their way. And then adjourning, which means you've achieved the objective, and yay, good for you. I will tell you that teams can get stuck. A team can get stuck in forming. You can be so polite and nice with each other that you never move beyond forming. That if you're never gonna move beyond forming, not much that you're going to get accomplished, perhaps, if you've really got a goal that you want to meet. Some folks get stuck at storming, and they cannot get out of the storming phase. And oftentimes, if a team is stuck in storming, they're not going to accomplish their objectives. And oftentimes, that's where, you know, management probably needs to be brought in to provide some heavy duty, maybe some rethinking about what that team is and who the members are of that team. Hopefully, though, a team can start to see themselves in that phase and start to kind of go, wait a second, you know, we're fighting all the time. Maybe we need to stop doing that. And then norming and performing. I will tell you, though, that, you know, as team members may change, you may go back and start all over again. So in a healthcare team, if you've had one provider or a number of clinicians that have been part of your team for a while, and then all of a sudden that person's moved on or transferred or gone away and there's somebody new in, that new person, oftentimes the team can either continue moving forward if they adjust into the team right, or the team goes back to the beginning where they're forming and they're all being polite with each other and we're getting to know you. And then, wait a second, now I'm not liking what you're saying. And okay, now we need to figure out how to work together. This happens in every group. It absolutely happens, I think, in healthcare teams, because you have different people that are a part of it. The way it's just something to be acknowledging and to understand. I think the way to move through the different levels is to really understand how to be an effective team or an ineffective team, and the components of those help a group or a team kind of move through the different stages. So when we talk about, you know, group dynamics and team dynamics, I think you'll see that an effective working team, and you'll think about this yourselves, teams that are not working effectively together, these are some of the characteristics of that team. But this is probably a team that's stuck in storming, lack of communication. Team members don't have a clear idea or role of what their responsibilities are. Team members throw the work over the wall to the other team members. Like, no, you do it. You do it. You take care of that. I don't have time. Or you know, forget the timeline or forget the quality of the work. Just get it done. People work alone. Think about that in your team. Do you have people who just would rather work alone and don't want to share information or offer assistance? Blaming other team members for what goes wrong. You know, there are times when things go wrong, and if the team is really not functioning well, they're going to be blaming each other. You did it, you did it. You don't support each other on a team. And if you have team meetings or team, there's people who are, oh, I'll drop into that team meeting, or I'm too busy, or, I don't have time for all this because I'm so busy doing other things. Those are characteristics of a team that is not working effectively. This is a team that's stuck, I think, in storming. They're just not able to get it together. But there are ways to fix that. A team that is functioning effectively, these are some of the components of that. There's clear communication among all members. Again, everyone understands their role, their relationship in the team. They identify as part of the team. There's clear communication. Everyone you're able to impart information with each other. You have an opportunity to meet together and brainstorm. I know in our busy healthcare lives that seems like a luxury, but a morning huddle where you're just kind of like, okay, how are we going to deal with this patient? That's brainstorming. There's consensus. Okay, I may not agree 100% with what you're saying, but I agree for the good of the group. Let's just try it. You problem solve as a group. You're committed. This says to the project, but think about it. You're committed to the patient, and you're committed to the patient's outcome, and you want to make sure that you're doing all as a team that you can to ensure that best health outcome for your patient. You have team meetings. That's again that morning huddle. If there's a handoff, if some team member needs another team member to take on something, it's done in a way that's effective. It's done in a way that the information is imparted. That handoff of information is not just that information dump. It's any questions? What am I missing? There's that handoff. And then again, the supportive working relationship among team members is, you can't say enough about that. You may not all like each other. You may not all be best friends. You may not all want to go out and have, a beer after work or whatever, but that doesn't mean you can't work together as a team. And I think as the team concept continues to grow and evolve in healthcare, if we can keep kind of these little components in mind, maybe we'll all be happier, and obviously our patients will be. So with that, I don't know if there's any questions, but I know this has been a lot of information kind of dumped, which I don't do an information dump. A lot of information, but I wanted to provide just some concepts for you to think about as you're thinking about your healthcare teams, thinking what you might do differently, some little tools and tips that might make you a better communicator, not just in work, but even with your own families and within your own lives. And with that, I will pass it back for any questions.
All right. Thank you, Kathy, for such a great webinar. And here we have so far we have one question, and that is, does the Myers-Briggs determine if you're visual, hearing, or kinesics, learner? I'm audio for some things, but then I need to see things visual at times to put it all together.
Mm-hmm.
So how do you assess your team or audience to determine the best way to communicate your information?
That's really a good question. I'm not sure about the Myers-Briggs, if that really helps you to determine whether you are, because I think we're all both. Sometimes I know I need to hear something, but I'm better at seeing it. And I think the way that you tell is if you have somebody you're working with where you're just telling them information, you're telling them what you want them to do, and they're just kind of like, okay, and it's not getting done maybe the way it needs to get done, or there's a problem with the result. It may be that person's a visual processor of information, and there's no like tried and true test that says, okay, this means you're this and this means you're that. It's really a bit of process and error. There's some there's some thinking that people that are visual learners can turn their look around. You can see their eyes kind of moving back and forth because they're seeing pictures in their head when they're when you're showing them something, or but I think it's just a matter of really paying attention. And I know that's maybe not a simple answer, but we are both. I know sometimes I hear things, but I know that in general, I see pictures as I'm going through something. I talk with my hands a lot, as you can tell, of course, probably because I'm half Italian. But yeah, I think we're both, and I think it's just a matter of just trial and error with your staff.
Great, thank you. We're waiting for any other questions, perhaps, from the participants. Not yet. Well, while we wait, maybe I'll just pose a question of how, do you get everyone in your team on board to use these skills or tools? Yeah.
Well, part of it is maybe the team maybe it's someone on the team kind of broaching the concept of, hey, we're storming, or hey, we're norming, especially in team dynamics. I think if there's, and using those terms may not be the right terms, that's the theory of, storming, norming, forming. But maybe, if you can see, if you're in a team environment or in a group environment where the group is just not doing what needs to be done, and I think we can individually say, hey, I'm noticing that this isn't working. We seem to be trying to do this, or we keep going back over this thing over and over and over again, and we never move forward. And it takes a brave person to do that. But if someone's brave enough to say, hey, I don't think we're achieving it, and what are we doing wrong? Not what are you doing wrong, because I think that's blaming, and we don't want to put blame on someone, but what are we as a group doing wrong, and how can we fix it? It really just takes one person asking that question. And again, it kind of puts the spotlight on you, because it's a little scary. It's like, oh, I'm putting myself out there. But unless you do that, unless someone takes kind of the responsibility to call the team out when they're not functioning and you're part of the team. And I think the way to say it is, I'm part of the problem. I'm sensing that we're not getting this done, and obviously I might be doing something that's wrong, but let's have a conversation and talk about it.
Great, thank you. We did have another question come in. Do you have any suggestions for moving a group when they are stuck, for example, in the storming phase?
Yeah, that's a tough one. It depends on where they're stuck at. What is it? Is it a personality issue? Is it kind of understanding why the team is stuck? I think what I just talked about, it really is someone calling the question of, well, why aren't we able to do this? It takes a brave person to do that. But why are we stuck? Why are we always fighting with each other? Why are we always not paying? Why are we always doing this to each other? What are we doing wrong? I think once you call the question out, and it, obviously it's not an easy thing to do, and you might need somebody to facilitate that discussion. That could be an outside person, another person from the health center or the health system, or another person from another department or another team can help come in and be a third party to say, okay, I'm going to help you have a conversation. But sometimes you can just figure that out. The group can figure it out itself. It's like, okay, yeah, this is what's going on, and this isn't why this isn't working. But they have to be willing. Everyone has to be willing to be open to share, and not be afraid that if they discuss their issues and concerns, that they're going to be attacked, or that they're going to be kind of shunned from the team. You really have to just ask the question, and that's the very first step in getting through storming.
Great. Another question is, what advice would you give for someone who works with the healthcare team on a quality improvement project but is not part of the immediate healthcare team? For example, an outside facilitator who only sees the practice once a month, but is trying to encourage the healthcare team to meet on their own more often.
So, oh, okay. So it's, yeah. So they're not a general team. They're just they're a team. Even though they're not a healthcare delivery team, they're not maybe seeing everybody and working in patient care about a patient, they still are a team. And so the same concepts apply, even though they may be coming together once a month. Some teams only come together once a year, but you're still a team. You're still a group of people who are working on a shared goal. And if that shared goal is once a month, you're meeting, I think it's important to, however the communication goes between those team meetings is probably the most important. What information is shared amongst the team members as they're, between team meetings, if they're every month or every quarter. If there's information that shares, that helps keep the team cohesive and moving together, even though they're not seeing each other as a team every day. So I think a team is a team, irrespective of how often you meet together.
Another question, how would you handle those who are resistant to change or have the why fix it if it's not broken attitude?
Yes, those are my favorite people. How do you, in some ways, some of those folks, I think you have to ask them questions and acknowledge, okay, you seem to, you don't want to do this. Tell me why. Tell me why you think this doesn't need to happen. If you're asking questions in a respectful manner, you're respecting their opinion. It doesn't help if that person is like the team leader, who's like, okay, we don't need to fix this. The team can come together and just bring forward information. Yes, this is why this needs to be fixed. It's not easy to do that. Naysayer is a hard one to change, but I've seen naysayers change when they've been presented with information in a respectful way. The one thing you don't want to do to a naysayer is prove them wrong and embarrass them. You want to make sure that if they're naysaying because of information that may or may not be quite correct, or hey, this has been working for so long, why do we need to fix it? If you can present the information in a respectful manner that acknowledges, yes, I can understand why you think that, but here we've just found this, this, and this, that can sometimes help.
Great. I think there's one more, and I'm going to have it be scroll down. Sorry. Here we go. Do you ever engage teams with activities, icebreakers to begin the relationship? If so, can you share one that you believe has been most effective?
Oh, it depends on the team and it depends on the environment. I mean, I've used icebreakers before. And I don't have a favorite one, and I mean, I can't think of one right off the top of my head. Sorry about that. If someone wants to email me, I can. My contact information is here. I can come up with some things, but I've used icebreakers before, especially if people don't know each other. Actually, I've even used icebreakers with my own staff in a staff retreat. One of them was, 3 lies and a truth was one of the icebreakers we used. Tell us 3 lies and a truth, and then the team had to figure out what was a lie and what was the truth. And that got a little crazy, but it was a lot of fun. But icebreakers can help, especially if it's people who've not worked together, as a way for them to get to know each other personally as they're going to develop a professional relationship.
Great. It seems like we are at time, and we also, I think, are at the end of our questions. So thank you so much, Kathy. We really appreciate this. And I'm just going to go over some housekeeping stuff. And before I continue, I just wanted to introduce myself because I realized I forgot to do so. So my name is Lubna Govindarajan. I'm the program coordinator for the Western Region Public Health Training Center here based out of the University of Arizona, College of Public Health. And I wanted to draw everyone's attention to a virtual conference that we are putting together. The registration is now open, and we're accepting abstracts as well. The virtual conference will be from August 22nd to the 24th, and it is on incorporating public health skills to improve quality of life, examples from Native American food systems. And the goal of the conference is to present and practice strategies in the areas of assessment, policy development, and assurance that can promote the development of local food systems and improve community health, particularly on tribal lands. Registration is free, so all you have to do is register and attend, and we hope that you all can join us. And next slide, please. The continuing education information for nursing contact hours, you'll see in the chat box the hyperlink to the evaluation form that you can access. We would like to request that you submit this form by 11:59 PDT today in order to get your CNEs. Next slide. And in order to receive your certificate for CECH or CPEUs, in order to get the completion certificate, please fill out the form found at this link, and this link is also now in the chat box for you to access. Please fill out the form within the next 7 days, so by 6:30, June 30th, please. Next slide. And then finally, we definitely value your opinion. Please feel free to give us feedback. We would really appreciate that. And here's the link in the chat for that feedback form. All right, and I think that is it. Those are our slides of the presentation. Again, thank you so much, Kathy. We really appreciate it. And thank you, everyone, for joining. Hope you all have a wonderful rest of your day.
Thank you. Bye now.